Welcome, everybody. I'm so pleased you're here today. This webinar is all about how to get through winter without antibiotics. So you may have heard some of this content before. This is one that I've done many, many times over the years. For those of you who are new and don't know me, my name's Nicole Cunningham. I'm a practitioner of homeopathic medicine. I've been in practice for 17 years. 11 of those have been in a virtual online space where I've worked in both Australia, in Indonesia, and now I'm based here in the US and have a global practice. So let's get into the content. Tonight is all about giving you insights, and my hope is that as you hear this information, you'll be able to identify people in your family, perhaps symptoms you have yourself, symptoms you've been able to identify in your children. And as I go through, you might want to make some notes that maybe this is some of the stuff that's going on for your family. So let's get straight into it. Why are our kids so sick? Well, none of this will come as a surprise, I'm sure, but the dramatic increase in technology, the exposure to electromagnetic radiation, this is the first generation that's ever had this much 5G, 4G radiation around them, the amount of screen time, and a lot of this is all untested. We do know that it has an impact on the neurotransmitters. We know it has a lot to do with the nervous system, and the nervous system and immune system work hand in hand because the second gut is actually, or second nervous system is in the gut, and the gut is such a critical part of the immune system. So I see that the electromagnetic unknown is definitely showing up as some causation and some compromise for the immune system. You add to that the fact that there's poisons and chemicals and pesticides in our water, in our fruits and our vegetables. We eat hormone-laden and antibiotics and loaded up meat and dairy. So there's so much stuff that's in our just everyday consumption with food. There's heavy metal toxicity, not just from immunization, but just from exposure from chemicals that are in our skincare, that are in our cleaning products, that are in our clothing, that are in our linens. There's so many heavy metals that are just in our environment, let alone paints and all kinds of aerosols, things like that. A lot of children have experienced a lot of antibiotics, a lot of cortisone, a lot of medications, and so this has a big load on the liver and the detox pathways. And then what I'm really going to spend the second half of tonight getting into is the underlying viral bacterial, fungi, and parasitic things that are underneath the surface that can massively compromise the immune system and the gut and be an obstacle to the immune system actually working and functioning in the way that we want it to. There's a dyes all around us. You add diet, stress, and emotions, and then genetically modified food. So there is just so much that our kids have to contend with, and the immune system can only do so much. The three major contributors to poor immunity that I have seen consistently in my clinic is sugar, dairy, and wheat and gluten. Now, as far as I'm concerned, these three are the major things that the minute that your children get sick, you eliminate. And you don't just reduce, you completely eliminate. And the reason for that is all three of these compromise and put massive load on the immune system, which means that the immune system is not going to work the way that you want it to. Okay, and the big issue that we have with antibiotics is not that antibiotics are bad, it's that the immune system should do the work so that antibiotics are actually not needed. And so it's not that I'm against antibiotics. I love antibiotics when they're needed. But what I prefer is that these three contributors to poor immunity be eliminated either in a short term or a long term. And I'm going to get into in a minute about food intolerances and how do you test and how do you know, and do your kids or do you have food intolerances, and how does that contribute to the suppression of the immune system through exposure and poor immunity. But really, antibiotics are there as a last resort. They should be there as a last resort. And a lot of GPs, a lot of ERs, a lot of medical doctors are spending a lot of time dishing these things out because they're not looking into the diet and lifestyle factors. They're not looking at gut health. They're not looking at the bacteria, the parasites, the fungi that are actually compromising the gut. And the gut and the immune system have a symbiotic relationship. So the minute that your children get sick, these are the three things to eliminate first, okay? Because that's going to mean that your body's immune system, your child's immune system is going to stay there. It's going to stay healthy. It's going to stay functioning. It's going to stay active, which is exactly what we want. We want it to do its job. The question, of course, is, do we have an intolerance or an allergy? And so how much do we have to eliminate? So I said already, with the first sign of illness, you get rid of these completely. But once your child returns to good health, to a stable condition, how do you decide whether you keep those things out or whether you make a decision to keep those in? And a true allergy is anaphylaxis by definition. However, I believe that this fine line between intolerance and allergy is actually a very slippery slope, and this is why. An intolerance can show up anything from 2 hours to 2 to 3 weeks after exposure. Okay, so you're not always going to see an anaphylactic reaction. You're not going to see a big skin rash or a high fever or diarrhea or breaking out in hives when you have exposure, unless it's an allergy. However, the allergies are more serious than the intolerances because they have a very exaggerated histamine response, and that can really seriously create complications. It can create a lot of breathing issues. It can create a lot of bowel issues. It creates a lot of autoimmune disease long term. But even intolerances can, if there's constant exposure and the diet isn't changed and the exposure to the contaminant is actually not reduced, that intolerance very quickly can become an allergy. And what we see there is this exaggerated histamine response. So whether it's an intolerance or an allergy, that's something that you need to work with your practitioner to say, right, where do we think that classification lies? And more importantly, what can we do to actually stop this? And then we're going to get into miasms in a minute and see how that's related. But to me, the intolerance allergy thing, as the years go on, as the contaminants, as the genetically modified produce is coming in, as the more glyphosate and the toxicity in these foods, because sugar really isn't what sugar used to be. Okay, sugar is now bleached. It's got added chemicals. It's got all kinds of nasties in it through the process of preparing it and packaging it and transporting it, all this kind of thing, because they want longer shelf lives and all of these things. So it's not a coincidence that we're seeing more children who have sensitivity to this now that we're in the year 2020 than what I had in my practice in the early 2000s. And that is because we have greater intolerance to these things because the body just can't cope. It's getting bombarded all the time. It gets tired, it gets run down, and the poor immune system gets to the point where it hasn't got much left. So let's talk about sugar. Now, the issue with sugar is that it actually suppresses the immune system and impairs its ability to fight disease. And this is why we want it out the minute that we have the sign of cough, cold, or earache, or anything like that. And sugar upsets the minerals in the body, and they create chromium and copper deficiencies. And these two things are all around blood sugar regulation, so pancreatic function. And chromium and copper also have got to do with emotional regulation and tantrums and the ability to have sustained and refreshing sleep. So if you think about a child who perhaps has been diagnosed or put onto the spectrum, or hyperactivity or something like that, or you just know that when your child goes to a birthday party and they go silly because they've had sugar, the reason for this is not actually just that the sugar is a problem. It's what the sugar does, in that the chromium and the copper go AWOL, and then it takes several days to actually get that back to some kind of stability. So if people say, oh, my children can't have sugar, yes, okay, they're sensitive to sugar, but it's actually what sugar does in the body that actually creates the problem. So what we do have instead is we have a very delicate immune system, and we have a delicate pancreatic function. Sugar also raises adrenaline and can cause poor concentration, hyperactivity, anxiety, and irritability. One and the same. Okay, so if you have children that struggle with these things, it really does become important that we eliminate sugar. But we don't want to eliminate sugar and then invite all of the toxins like aspartame and all of these other sugar alternatives, because they have side effects of their own. And I go through those side effects and what they really cost you and your family and their health in others of my webinars. So if you're interested in that, please reach out to me and I'll send you the links. So sugar really is one of the culprits that's a big problem. The next is dairy. So many children can't break down lactose in milk. Okay, but also when they do tests on dairy milk and the process of homogenization and pasteurization, all these kind of things, there's a lot of chemicals that are used in those treatments that we've become very sensitive to, and also they have to take out a lot of blood and a lot of mucus. Okay, so I apologize if you're a vegan or if you've got a bit of a weak stomach, but a lot of the milk that is taken from the cows in these mass dairies, or who have thousands and thousands of cows, and it's just a money-making machine. A lot of them have to go through a lot of bleaching processes, a lot of additional chemical processes to get out the mucus and the blood that is actually in the milk. Now, if that's not enough to put you off dairy for the rest of your life, I don't know what is, okay? And if you want the study that's specifically about that, I can share the link with you, send me an email. But reading that study a few years ago was definitely the turning point for me, that I do not have dairy in my life, okay? In addition, they have a lot of additional hormones. Okay, I used to work as a homeopath treating mastitis in cows and cattle. I work with a lot of mobs of sheep, and I work with herd animals with homeopathy to prevent infections, to work with weaning, a lot of contagious diseases that can go through the amount of animals. And so over the years, as I've done more and more of that, I've been exposed to the amount of additional little extra steps that are in the industry that involve chemicals and hormones and antibiotics that are not necessarily declared, and they're considered to be industry standards. But when you really get into the thick of it, it's things that you think, no, I probably wouldn't want to put that in my body. Okay. And the other thing is that even if your dairy is if it comes from good organic cattle and you're getting even raw milk, these things are much better because they haven't been put through these chemical processes, of course, and all the additional homogenization and the heating and the bleaching and all of these things. But I always have to question, what were the cattle fed? So in the same way that my health is the result of what it is that I eat, and when I have my offspring, when I have my children, they're going to be as healthy as what my diet has been. It's the same with when we take produce, and when we take things from animals, we've got to say, well, what is it that they're eating, and how healthy is it that they're eating? Now, a lot of cattle are fed on grain, a lot of cattle are fed on soy, and both grain and soy are both inflammatory, and they're not good for women. Okay, so we've got to start looking at these and going a little bit step deeper and say, how are these cows being looked after? How are they fed? What is the level of stress that they have? Because all of these things affect the dairy that we then have in our fridge. And you probably know this already, but cow's milk is for baby cows. And why? Because they need to grow really, really quickly. So what have you noticed when you have too much dairy, or people who drink too much dairy, or babies are fed cow's milk instead of breast milk? They become very, very big. They put a lot of weight on. Okay, their lymphatic system gets clogged. They get constipated. They have a lot of issues with their bowel. Why? Because dairy is full of really, really high fat, and things that slow down our digestive system. So babies put a lot of weight, teenagers put a lot of weight on when they eat a lot of dairy. And so that in itself, you've got to look at and make some decisions and say, well, how healthy is that for my growing child? How healthy is it for me? Dairy hypersensitivity can show up for you and your children anything from 2 hours to 2 days after, and I would say extending that to 2 and 3 weeks afterwards, because I have seen that in clinic. So if your child has dairy and they still have sloppy stool 3 weeks later, and they're having night terrors and they're unable to sleep, then we know that there is possibly a link with dairy. So symptoms of dairy intolerance that I'm looking for include loose stools, tantrums, irritability, depression, mood swings, hyperactivity, tiredness, dark circles under the eyes. This is a really, really big one. It's a giveaway for kids. And of course, skin issues, everything from chicken skin to eczema, unexplained rashes, hives, things like that. So skin is always a really big giveaway when it comes to dairy. So the question then becomes, should I be testing my child or myself for dairy hypersensitivity? And what is that process? Now, the good thing is that if you eliminate it, you're going to know, okay? So you don't have to go and have blood tests. It's not going to show up in any kind of Western medical test. It's more a matter of completely eliminating it. So if you completely eliminate dairy for a month, you will see a massive difference. However, within 2 weeks, normally the skin starts to clear, the bowel starts to improve, the acne improves, the mood, the irritability, the better quality sleep. All of those things you will see normally within 2 weeks, and that's a really good giveaway. So dairy causes mucus, and this is how it links into the whole antibiotic story. So what is it that happens when we eat dairy? Well, we start creating more mucus, and the mucus starts to pool in all of the sinuses. And so sometimes what I see in my clinic is I'll be treating an acute cold. They'll have a birthday party, and they might have ice cream or cake or something like that that has a lot of dairy in it. And within 6 to 12 hours, we have a green and yellow discharge in the nose, and we have a lot of stagnation and facial pain from sinus. And so just from having dairy and sugar at a birthday party, we can go from a cold into a full-blown sinus infection, throat infection, things like that, ear infection. And so whenever I hear in my clinic a history of infectious illnesses that are in the ear, nose, and throat, I'm always looking for a dairy intolerance, and I'm always looking to try and do an elimination. And so if you don't want your children to have antibiotics, and you're concerned about how much they've had, and perhaps they don't bounce back the way that they should because the immune system isn't strong enough, or they have a slow recovery time, or they catch everything that goes around, or maybe you have 3 months of illness in your house over winter where everyone just keeps infecting each other, dairy is definitely one to look at, because the more mucus that you have in your sinuses and dripping down the back of your throat, the perfect breeding ground for bacteria. So those of us who don't have dairy in our diet, we may have a cold, but it doesn't become a full-blown infection with pain and needing to go to bed for days at a time. So sometimes just eliminating this and identifying that food intolerance can be enough to stop this cycle of infection. The next one is wheat. We talked about sugar, we talked about dairy. Now let's get into wheat. Now wheat, the big question, of course, is wheat and gluten, should we eat it? And it's not what we think, okay? Wheat in its true clean form, which is what it was before Monsanto 25 years ago, before the glyphosates and all the pesticides and the endocrine inhibitors and all those nasties came in, it actually was really good. And for anyone who's lived in Europe, traveled through Europe, and been able to eat bread that is not full of glyphosates, you will find that a lot of the time you can tolerate it. But those of us who live in America and Australia and Asia, we don't get that luxury, okay? We don't have wheat that's readily available that is organic without these glyphosates. And so my opinion has changed over the years. Having been in practice for 17 years, watching the trends, I have found that a lot of people who can tolerate wheat and gluten is only when they have organics, but it still does create damage to the gut if you have too much. Whereas people who are very, very sensitive to gluten, very sensitive to wheat, it's not just the wheat itself, it's the glyphosate, okay? And it's the fact that we have hybridized wheat that has an additional toxin of sodium azide. And so a lot of the time it's glyphosate toxicity and sensitivity to this sodium azide that causes all of the gut issues that we put down to being celiac, having sensitivity to gluten, to wheat. So if you can find organic spelt, or in Europe, that's what they call it, wheat is actually organic spelt. If you can find that, you will probably find that you can moderate it. You can have a little bit of it. You can enjoy it because it is delicious, but it is addictive. Okay. But you will find that you probably have greater tolerance. So what I do with a lot of my patients nowadays, particularly if they are on that revolving door of antibiotics, so I will do a food trial. I'll get them to completely eliminate glyphosate and the sodium azide in the first 8 weeks. So instead of completely eliminating wheat and gluten, we'll just go to organic form. So I'll be looking for an organic wheat, organic whole wheat, things like that. And normally within that 4 to 8 week period, we will see that they have a really good tolerance. It's only for those small amounts of the population where they truly are celiac that then they still have the symptoms of what that wheat and gluten intolerance looks like. So I really believe that the glyphosate and the sodium azide are a bigger problem than the gluten for majority of the population. However, gluten-free and gluten intolerance and celiac is a real ball game. It's a serious thing. It causes a lot of damage in the gut. And so if you do have that diagnosis, please do the work. Okay, get it out of your diet, get it out of your life. Don't be tempted by it. Just make a decision that your health is more important than that, and completely eliminate it. Because if you don't, you will find that you are on a very, very fast road to autoimmune illnesses and to chronic disease. And that's a lot of work to come back from that. Okay. So the gluten is actually a lot of the issue for digesting. Okay, the gluten is the problem, but for a lot of us, if we have organic wheat, we can have it in small amounts. The other thing is that it contains the physic, which is in the hull of the grains, which actually inhibits mineral absorption such as calcium, magnesium, iron, and zinc. So the first thing you think of that is the MTHFR mutation. So for those of you who don't know about that, put that into Google, okay, or send me an email and say, what is the MTHFR mutation and what does that mean? That means that we have undermethylators and overmethylators. I don't want to spend too much time here, but basically that's a big portion of our children who have recurrent illness. It's a big portion of our spectrum kids. It's a lot of our children who have focus and concentration issues, who have failure to thrive, who have gut issues, who struggle with depression and sleep issues and poor immunity. So and this is where the methylation kind of goes hand in hand. And if you do have the MTHFR mutation, you really should be gluten-free, in my opinion. Unless you can get consistent organic wheat and you're only having it once or twice a week. But there are great alternatives such as spelt rice and kamut, and my favorite grain, which is the least acidic grain for those of us who are working through autoimmune disease, is quinoa and brown rice. So there are lots of alternatives out there. It just means getting away from the SAD diet, the standard American diet, getting away from processed wheat, getting away from refined sugar, because often these things go hand in hand. And of course, they create a lot of suppression in the immune system, which makes us sicker and be more reliant on antibiotics to be well. The next thing I want to talk about is homeopathic miasm. So this is a fancy word for the predisposition to a group of illnesses. And if you'd like to know more about this, I actually have a full separate webinar all on miasms and the implication. But homeopathic miasms really become important with the cycle of antibiotics, because we're talking about recurrency of illness, we're talking about chronic disease, and we're talking about deterioration of health. So you'll see here that on the left-hand side, we've got birth, and on the right-hand side is death. And this is really a timeline for illnesses, and this is relevant to both children and adults alike. So there are 4 different stages of illnesses based on these four miasms, and these miasms represent your genetic predisposition to have a certain amount of illnesses. So for people who have a lot of recurrent illnesses, they're often sitting in the tubercular miasm. Now, the tubercular miasm is one where they're exhausted all the time. They don't have the vitality to throw things off. So things become bacterial or become very extreme viral very quickly. So the patients in my clinic with an active tubercular miasm will have a history of terrible tonsillitis or recurrent ear infections and needing to have grommets or tubes put in their ears several times, or having to have their tonsils and adenoids removed at a very early age because they just couldn't get any off the antibiotics. Okay, and so this is a very typical presentation when people come and seek out help from a homeopathic practitioner. Is they'll say, look, I just can't keep the antibiotics going. We're now having side effects of the antibiotics and we're not getting anywhere, and we just have this recurrency revolving door. I live at the GP. The other type of patient that I see who has a lot of dependency on antibiotics has an active psychotic miasm, which is the second miasm. Now, this one is all about sluggishness and congestion. So the people who live here often struggle with a lot of sinus, and they have a lot of throat and chest infections as well. So things sit. So people who struggle with pneumonia, who have asthma, who have a lot of these very sluggish lung conditions where they can't cough up the sputum or they can't get the liquid out of their lungs. And similarly, they have a lot of chronic catarrh and discharge in the sinuses. They have a lot of pain, they have a lot of headaches, they have a lot of sinus and recurrent infections and a postnasal drip. And I treat a lot of this with antipsychotic medicines. Now, that's not psychotic as in crazy. This is the psychotic miasm where things really slow down. And all of my my patients, my greatest intention whenever somebody comes into my care or when a family comes into my care is to get everybody into SORA, because we want to live in SORA. Now, SORA is the first miasm where no matter what it is that we come up against, whether it be bacterial, whether it be viral, whether it be genetic, we have the integrity in the vital force, which is our body's ability to heal itself, to actually throw this off. It's highly responsive and highly reactive, which means that we may be on an aeroplane and there might be something that is going around the plane in such a close environment. And if you're in SORA, you'll get off the airplane and you won't get sick. Or you might have a very mild sore throat that resolves itself in a few hours. Whereas those people who have active psychotic and tubercular and syphilitic miasms, they're the ones who come to me and say, oh, I drove to the airport, I got on the plane, I was completely fine in the car, and then the minute I got on the plane, I just could feel all my sinuses just closing off, or I started getting a sore throat and a headache, or I started coughing, and of course, it always happens. I always get sick every time I travel, and now I'm back on antibiotics. That's a very, very common story and presentation when people come to seek treatment. So this is an active psychotic and tubercular miasm. Now, the good thing is not only do we prescribe homeopathic medicines instead of antibiotics to give relief and to resolve the cold and the infection, which is wonderful. It's a much natural way of treating the ailments and the symptoms, but we also give these anti-miasmatic medicines that shifts the patient from this recurrency and sluggishness into SORA, so that then this cycle of illness, this deterioration and this chronic illness changes for them, and they can literally change the course of their life. So it's a very exciting part of my practice to be able to do this miasmatic work, and every person who comes into my clinic gets anti-miasmatic medicines. So let's talk about now the link between antibiotics and gut health. So as I mentioned before, antibiotics are fantastic when you need them. But one of the biggest problems with antibiotics is, at the end of the day, even penicillin, it has a load on the gut, it has a load on the liver, because all pharmaceutical medicines do. So anytime that you take a over-the-counter prescription or you get a script from a doctor, you are putting additional strain on your body, even though it has side effects, okay? We can't get out of that, unfortunately. The other thing is that you will experience a imbalance of the microbiome every time that you have antibiotics. And if you do not repair that microbiome after you've had antibiotics, you can then have deteriorating and accumulative gut health issues, which then lead to a whole bunch of other autoimmune and chronic diseases. So excuse me. So gut health is a really critical part of this antibiotic revolving door that I see my patients. So every time that you do have to go on antibiotics, and we do want to reach for antibiotics when we need it, okay? But we don't want to reach for it when other options are there. And definitely we want to stop this cycle of recurrent antibiotics, because when we reach for the antibiotics, we want it to work. We don't want to have had so many antibiotics that we then get something that's called antibiotic resistance, which I see a lot of in my clinic as well, which is the doctor has to prescribe 4 or 5 different antibiotics because that one didn't work, and so we're going to change and we'll give you a script for this, and then 2 weeks later the infection's still there, and before you know it, you have been sick for 3 or 4 months of the year, and your gut health has been completely destroyed in the process, because antibiotics go in and they completely destroy the microbiome. So that is the good, healthy bacteria that is in the gut, because they go in and they kill everything. Okay, because they're trying, that's what an antibiotic does. It goes in there and it kills all the nasties, but it kills the good with the bad. And this is why the restorative gut health after antibiotics, or at the same time as natural treatment to try and strengthen the immune system, because the immune system and the gut have a very symbiotic relationship. Introducing probiotics, fermented foods, kefir, kombucha, and bone broth will be some of the best lifestyle and diet things that you can introduce into your home. So probiotics do not have to be $150 a bottle. Okay, there are great homeopathic remedies that you can get from a really well experienced homeopath who will know how to use medicines to recultivate the bowel so that you don't have to rely on expensive supplements. So if you have a homeopathic practitioner, ask them, what can you do on a probiotic level? Because anybody who's worth their salt, so to speak, in the industry will know what to give you. In addition, things such as kimchi, fermented foods, sauerkraut, having a tablespoon of that with your dinner every evening is a really wonderful way of introducing fermented foods. Now, fermented foods and fermented drinks such as kefir and kombucha will actually activate the microbiome and will cultivate a diversity of bacteria, healthy bacteria, that then will stabilize and encourage a really healthy microbiome environment. So your microbiome is really the integrity of that, and the strength of that is actually the integrity and strength that you have of your immune system. So this is something you want to cultivate all year round. I like to have a shot of kombucha before I go to bed every night, and it's a really inexpensive way of getting probiotics into my life every day. The kids love it as well because it just tastes like a fizzy soft drink, and particularly if you have an alternative or a very health conscious lifestyle, your kids won't have had things such as soda and fizzy drink and things like that. So it's a real treat. And finally, bone broth. Now, bone broth is it probably is the best thing that you can do if you have leaky gut. If you have any digestive discomfort, flatulence, constipation, bloating, bone broth will actually go in there and heal the microvilli. So the microvilli are little tiny hair-like cells that are in the small and large intestine. And not only are they responsible for the intestinal transit time and elimination, but they also have got to do with absorption. So you want to be absorbing all of the nutrients that you're getting from your food. And people who have chronic immune diseases and a lot of nutritional deficiencies have this because the integrity of the gut has been wiped out because of antibiotics. So bone broth will go in there and actually recultivate and get those microvilli open and absorbing the nutrients, increasing the intestinal transit time, so which means that you don't have constipation and sluggish bowels. But it also will go in there and repair any kind of damage that's been done in the lining, which is what we know as leaky gut. So again, these are a whole webinar topic, and I'm trying to just give you a few little snippets. But if you do want a really good, tried and tested, easy bone broth recipe, just send me an email. Okay, so this is my strategy of getting through winter without antibiotics. My children are 9 and 12. They have never had a pharmaceutical medicine. They've never had an antibiotic. And this is because this is what works for my family. This is also what I extend into my clinic. I've been doing it for 17 years, and I have hundreds of families who are on this kind of preventative and wellness care, which means that they don't have to reach for antibiotics unless it's absolutely essential. So the miasmatic stability, that's that chart that we went through, making sure that the miasms are stable and that all of the family members are in SORA. That's the number one thing to do. The second thing is to invest your time, your energy, and your finances into good, consistent gut health, which I just went through. The next is to identify and eliminate food intolerances and then detox heavy metals. So this is now the second half of the webinar where I'm going to start talking about food intolerances. I'm going to be talking about these hidden things in the gut and these hidden obstacles to cure that are actually compromising the immune system. So signs of food intolerance, and this can look like gluten, it can look like wheat, it can look like sugar, it can look like soy, it can look like eggs, it can look like peanuts. Anytime that you have a food intolerance or allergy, these are the symptoms that will show up. So as we go through this, I encourage you to think about all of your family members and yourself. Strong smelling urine, hyperactivity, poor attention and focus, irritability and mood swings, fears, anxiety, and phobias. Bedwetting, this is a massive, massive one. Bedwetting is so big in my clinic. And when I do the gut repair, which I'll share with you in a minute, it is just night and day to see these kids. I have a lot of kids who come to me who are still 14, 15, and 16, who are wetting their bed. And of course, it has all kinds of social and emotional implications. And when we heal the gut, it's just miraculous. Night terrors and poor sleep, And so we have to work through the layers and look for underlying obstacles of cure. So the first part is to identify the food intolerances and get those out. And then if that is not enough, which is often the case because food intolerances and these layers that I'm going to get into now, they go hand in hand, that one is often the cause of the other. So my clinical strategy, when I see any of those symptoms and I don't get enough change from the miasmatic stability and the elimination of those foods that are the food intolerance or allergy, is to start looking for evidence of these things in the bowel: Streptococcus, E. coli, Enterococcus, Staphylococcus, Klebsiella, Clostridia, Candida, parasites, and low-level viral conditions. Now, don't freak out, okay? You don't need to have tests. A lot of my patients do have tests and they come to me and say, right, I want your homeopathic treatment for this. I've had a stool culture taken and these are the test results that have come up. So a lot of people choose to do that and then come into my clinic and say, okay, I now want you to treat it with homeopathy because I don't want the big bomb, so to speak, the pharmaceutical bomb that's going to completely wipe out the microbiome, because I understand that that's already happened from a lot of the antibiotics that my children or myself have been on. And so I don't want to do it that way. I don't want the bomb that's going to go in there and destroy absolutely everything, because I know I've then got a 9 to 12 month journey of actually recultivating the bowel, which means I'm then more high risk to have a suppressed and immunocompromised position, and I want my immune system to be strong. So instead, I want you to do it with homeopathy. So I spend a lot of time and energy with my kids in my practice, identifying and doing the case analysis about which of these are actually active in my patients. So not only do these show up for people who have a lot of antibiotic resistance or who have a lot of recurrent infections and they require antibiotics, the other way that this often presents is people who come to me and say, I've never been well since that trip to China, or I went to India backpacking and my gut has just been terrible ever since, or I can't eat a single thing without bloating or having flatulence and diarrhea. Or people who come to me and say, I've always been constipated my whole life and I just am putting weight on and my bowel doesn't work. And it's literally, I'm surviving on laxatives and enemas. So this clinical strategy has lots of different clinical presentations in terms of symptoms and how people suffer. But I think this is really relevant to early childhood and to those school years where you'll see a lot of these symptoms show up. So let's talk about Streptococcus. Now, Streptococcus is a particular strain that decreases the pH in the gut. And when that's low, we have very, very poor absorption and breaking down of food, which means that it feels like when you eat, there's a stone in your stomach because the body doesn't have the fire and the pH that's acidic to actually break down that food. So they really struggle with eating anything. They'll come in and say to me, I always have a sore tummy or always feel bloated no matter what it is that I eat, and I just can't work it out. It also increases lactic acid and affects the bile acids and fat absorption. So these people live with chronic pain, okay? These people have muscle cramps. These people have growing pains. A lot of children that have growing pains will have Streptococcus in the bowel. Frequent infections, nervousness, memory loss, forgetfulness, brain fog, confusion. So this will often come up with a lot of my spectrum kids who come to me because they've got learning problems such as dyslexia, or they can't concentrate in class, or the report or an email came in from the teacher, which is they can't focus, they can't concentrate. Children who have ritualistic and repetitive behaviors and OCD tendencies do incredibly well after we strip out the Streptococcus from the bowel. It can literally be night and day with kids who are stuck in these kind of, very tormenting behaviors. A lot of my patients who have Tourette's syndrome, and involuntary tics, they do incredibly well after Streptococcus is stripped out. Language, verbal stems, and issues with sleep. The next is E. coli. Now, our E. coli actually is in our body and it's in our gut, but it's got to do with the levels. So it can become toxic or it can actually be something that serves us, but it's actually there biochemically and organically there already. But it's when we have E. coli exposure that we then become ill. So E. coli is needed for synthesis of amino acids, which are proteins. Okay, so to break down protein, you do need E. coli. But it is also needed for folic acid, vitamin K2, and CoQ10. So again, we think about the MTHFR mutation and those kids and adults who really struggle with under and over methylation, they have a great sensitivity to E. coli. So a lot of the time they will have actually caught imbalance of that E. coli. They'll get it through food and through exposure from food that's not prepared well. And so that can be enough to just tip the gut and have a whole bunch of symptoms. Poor recognition and memory, UTIs, respiratory problems, and pneumonia. I've seen a lot of Alzheimer's patients and people who have really poor memory recall and auditory processing have issues with E. coli. The next is Enterococcus. Now, this one actually damages the intestinal wall, and a lot of people who are diagnosed with leaky gut actually have Enterococcus overgrowth and a real spread and contaminant in the gut. These people struggle with UTIs, abdominal pain, consistent and continuous residual infections. They have a lot of antibiotic overload because they're sick all the time. They also have poor absorption and breaking down of foods. They feel like they've got a stone in their gut every time that they eat. They also suffer with the joint pains and with the growing pains. They can't break down fat, so they're often overweight because their gallbladder function is compromised as well because of that symbiotic relationship, and they become very toxic very quickly. So Enterococcus is one of the ones that shows up in a lot of my cases. It's one of the ones I look for first because a lot of people struggle with these multiple system ailments. They'll come to me and they won't just have symptoms that affect one body system, just the hormonal system. It's often hormones and nervous system, or it might be gut and immune system together. And with a lot of these cases and the complexity of these cases, there's a lot of these overgrowth and overloading in the gut that a lot of your family practitioners and the people that you go to, when you've got these symptoms, they just don't know what to look for, and they don't know what to identify. And then oftentimes they don't have the way to actually strip this out in a healthy way without completely overloading and destroying the microbiome. So this is a big part of my practice because it affects a lot of people. It's a big portion of the population that have these issues because they have these strains that are overtaking the bowel. The next I want to talk about is Clostridium. So these ones produce spores. They're harder to clear. They can take up to 3 weeks. They come from contaminated food. They can cause neurotoxicity. I've seen people who have MS and degenerative neurological diseases, Lyme diseases, things like that, also have Clostridium test up. It's associated with eczema and a lot of the asthmatic type stuff, wheezing, allergic sensitization, hay fever, hives, all of that very reactive environmental pollutant type stuff, as well as the inflammation in the bowels, the serious inflammation such as Crohn's and ulcerative colitis. These people who have Clostridium in their bowel and overtaking their microbiome, they will suffer with frequent fevers and chills and diarrhea. They'll have bloating, flatulence, stomach pain, and often the case they'll have leaky gut. Now, it's worth mentioning that a lot of my patients have 2 or 3 of these at the same time, okay? So there has to be time and protocols, and there's push-pull, what we do with homeopathic remedies, and we do food changes. It's a very, very delicate thing, but once we map out that treatment strategy, it's a beautiful result at the end, and we clear all of these things, and they're done permanently, which is wonderful. Klebsiella is the one that I see mostly in young children because it's linked to infant colic, IBS, because there's inflammation in all of the sphincters. So sigmoid, in the digestive ones in the esophagus as well. So kids that are having silent reflux and constantly regurgitating milk, as well as ileocecal and sigmoid valve. So those 2 are the ones that are responsible for correct elimination. So a lot of children come to me with bowel impactions and things like that. It's often always Klebsiella. So really important thing to clear out of the bowel to stop this cycle and recurrency, because not only is it very invasive to have enemas and to it's very unhealthy to be on laxatives all the time, but a lot of kids can experience a lot of trauma from having these bowel impactions because they're terribly painful. So this is definitely something that if you have a child that has bowel impactions or frequent constipation or recurrent constipation, if they're not passing stool twice a day, they're constipated. Okay. Even breastfed babies, you know, there's a big, you know, highs and lows, and there's a big scale within that. But if there is recurrent constipation in children, Klebsiella is definitely one that you want to look at. Long term, it can predispose to reactive arthritis because there's so much bowel toxicity that becomes systemic toxicity from not eliminating waste. And so for people who have Klebsiella, and for infants, the lactobacillus being taken by the breastfeeding mother or given orally at the same time as comp feeding can really be a breakthrough. Candida, I'm sure you know this one, okay? Candida can, it's always in the bowel, okay, but it can be systemic. It can affect systemically everything from brain function to poor sleep, sugar cravings, skin involvement, gut involvement, and even nervous system. So neurotoxins, not being able to think, having that brain fog. I've seen emotional responses like inappropriate laughter or inappropriate and over the top with weepiness and emotional exaggeration. Poor sleep, sugar cravings, skin rashes, it's all there. Of course, vaginal and oral thrush are a really big presentation of Candida in my clinic. And this one is one that this is almost more prevalent in my clinic in the last few years than oral and vaginal thrush, is frequent urination and interstitial cystitis. This is inflammation between the different layers of tissue in the bladder, incredibly painful. Incredibly difficult for Western medicine to treat, but when we eliminate the Candida and homeopathic medicine miasmatically, we get some really beautiful results. Candida also shows up as a pimply rash, rash, but that rash that looks like chicken bumps and little white pimples that often is on the top of the legs and the top of the arms. This is something that we're looking for with gluten and wheat sensitivity also. Okay, parasites. This is one that you probably know of. I like to worm my children once a quarter, so every 3 months. I do this because they play with animals, they play with other kids, they play in sandboxes, they touch playground equipment, all of these things, and parasites are very easily transferred. So everything from ringworm to threadworm to, you know, all of the different varieties of intestinal parasites, we can clear that in a healthy way with homeopathy. So a lot of the symptoms that present the quickest and the most immediate, if there is a parasitic overgrowth, is aggression and defiance, meltdowns, tantrums, high highs, low lows, irritability, teeth grinding is always a giveaway, the mood swings, the exaggerated responses, any kind of cyclical stuff with the full moon, so night terrors at full moon or really difficult behavior or poor concentration or fighting and arguing around the full moon, you always think parasites. Disturbed sleep, fecal smearing and itching. I know that sounds extreme, but I do see a lot of it. Allergies, both food and then ear, nose and throat and skin with hives. Loose, foul-smelling stools with mucus, distended abdomen, and of course, long-term parasites can cause anemia and lethargy because they're eating all the nutrients, okay? You've got bugs in your gut that are eating the food instead of strengthening your kid's immune system, making them grow healthy and strong. You're feeding parasites, okay? So eventually, if it's been there a long time, it can show up with anemia and lethargy. So where do you get started? Okay, let's get into that and how it is that you can prevent this antibiotic cycle with your kids and with your family this winter. We have to simplify. The body is a computer. It does really well when it breaks down 3 things and 3 things only: carbohydrates, lipids, which are fat, and proteins. Anything outside of that, including genetically modified things, additives, preservatives, neurotoxins, endocrine inhibitors, chemicals, pesticides, anything that is extra, the body doesn't know what to do with because it was not programmed to be able to manage that kind of code. So anytime that it does that, it goes, I don't know what to do with this, and it stores it in the liver and it stores it as fat. Okay, so the easier a winter that you will have, or that you will have a better winter. This is a better way to say it. You will have a better winter when you simplify your children's diet, when you simplify the meals that you're preparing. Keep them focused on those three things: proteins, lipids, carbohydrates. Okay, mix it up. Make sure they're organic. Make sure they're nutrient dense. Okay, get rid of packaged things that have 15 ingredients. Whenever I go shopping, I'm not only looking for a non-genetically modified label, I'm looking for an organic label. I'm also looking for the least ingredients, because the more that this ingredient has been tampered with, the harder that it's going to be for my body and my children's bodies to actually break down. And food is medicine. When you give the body nutrients, it activates the mitochondria. The mitochondria is the part of every single cell that creates energy. So if you're tired, you don't have activated mitochondria in your cells. And I have a webinar on that. If you haven't listened to it already, reach out to me. I'll send you the link. Why am I tired all the time? How do I get more energy? It has to do with this mitochondria. So use food as medicine. Now is a great time as you go through seasonal change and you're preparing for winter and you're getting head around, I don't want to do what we did last year. I don't want the same outcomes as last year. So start really working on the balance between the acid and the alkaline diet. I encourage all of my patients in my clinic to have an 80-20, 80% alkaline diet, 20% acidic. So acidic includes things such as meat, grains, dairy, and the alkaline, of course, is organic fruits and vegetables that are non-GMO. So if you want to get creative and you think, gosh, where do I start? Google things such as paleo. Google things such as plant-based diet to get inspiration to do meal plans. But the more alkaline you and your family's diet is, the better building blocks it has to activate the mitochondria, which strengthens the immune system. So we want to be making sure that we're building up our kids, building up our own immunity through the food that we're consuming. I use mono meals, which is choosing to have one nutrient for a few days at a time. This is a wonderful detox strategy. I talk a lot about mono meals, the raw food diet, and water fasting in my detoxification webinars. If you haven't listened to that and you want the link, email me. But these things are simple for the body to break down. They're simple for the body to adjust, which means that the body then has all this excess energy to go in and repair. So if your children are coming down with a cold, or they are getting the beginning of a fever or an ear infection, you want to simplify their diet. You want to get down to the basics. So I will often choose one in-season organic vegetable or fruit that I can get plenty of. And that's what I feed my kids, because it's simple computer code for the body to break down, which means there's more energy to go into fighting the fever and fighting the bacteria and fighting the viral or the microbe that's actually causing the problems. So we want to simplify everything down. And of course we want to have soups and broths and things like that, but we don't want a 15 ingredient soup. Okay. We want simple things such as, sweet corn soup, or chicken and sweet corn soup if you like those things. Or we do broccoli soup, or we do potato soup. Okay, we do carrot soup. And when you do soup, we don't add in a whole bunch of cheese and condensed milk and all of these other acidic things that are going to suppress the immune system. We stick to one organic fruit and vegetable. We blend it up, and that's what we do, because we want a mono meal even when we're sick. Not always raw. You want to do hot as well. Sweet potato soup, things like that. And the more plant-based variety that you can get, the more exposure to multiple nutrients. And this is really important too, because you want a variety of foods. You want a variety of nutrients. I always say to my patients, make sure your shopping trolley is colorful. What else can you add in there for more color and more variety? Because the more color, the more variety that you have, the greater the nutritional profile and the density of nutrients that you'll be introducing into your body. And if you are somebody who's struggling with inflammatory illness, or chronic disease, water fasting and liver gallbladder detox are really important of your part of your health journey. So if this is something you haven't done already, please reach out to me. I can help you and I can support you through those things. The liver and the gallbladder are the major detox organs, and they have such a symbiotic relationship with the gut. So a lot of people who need antibiotics also have sluggish liver and sluggish gallbladder. All these things work together. And this is the great thing about holistic medicine, homeopathic medicine, is we treat the individual. We see the person as a full entity. We don't just say, oh, there's a sore throat, or there's a sinus infection, or we have pleurisy and liquid on the lungs. How did it get there? What was it caused by? What other organs in the body have been compromised and need support so that then this doesn't happen again, because prevention is always, always better than cure. So I hope this has been valuable. I hope that you've got some tidbits from here. I hope, if nothing else, the only thing that you got from today, hopefully there's more, but if there's only one thing you got from today, my message is use antibiotics as needed, as a last resort. Don't feel bad for using them, because there is a place. However, overuse of antibiotics has got to do with corrective medicine instead of preventative medicine. Preventative medicine is food is medicine. It's miasms, it's food intolerances, it's getting gut health under control. All that information was in this webinar. And the minute that you or your family have any signs of acute illness, ear, nose, and throat, a cold, a virus, a bacteria, anything that is compromising you, please eliminate 3 things: sugar, wheat, dairy, and gluten. Okay, gluten, wheat go together, sugar and dairy, because those 3 things, more than anything, are what I believe are responsible from a cold turning into an infection, okay? Needing to reach for the antibiotics. So the minute that those symptoms come, you eliminate all of them, okay? And you eliminate them until the cold or the virus or the bacteria is completely over. And then you would be looking at those lists of symptoms that were in today's webinar about food intolerances. Is this something that you live with? Could having those things in your diet, in your life, in your pantry, be contributing to this cycle of recurrent illness that you're experiencing with you and your family? So hopefully this has been of benefit. There are all my contact details. I'd love to hear from you if you have any questions or comments, or you need links or help. I'm here to help you in any way I can. Thank you for joining me, and I will see you next time.